Hey you guys, it's me Adam Deshawn with another video. So one question that I have gotten a lot here lately is the difference. People wanted me to explain the difference between working in the hospital, working in a nursing home, and then also what are the differences between a long-term care facility and a skilled nursing facility. So while I've got you guys, go ahead and please give this video a like and go ahead and subscribe to the channel while I have you. I promise you this video is going to give you a lot of awesome information, okay? So go ahead and do that for me. I'm really trying to grow this channel and I would really appreciate you guys' encouragement. So let's get right into it. The hospital. Now this is a very detailed question because the hospital houses so many different types of nursing within one hospital. You can work in the emergency room, you can work on the med-surg unit, you can work in the ICU, and then you have surgical ICU, medical ICU, neuro ICU, cardiac ICU. You can work in surgery, same-day surgery. So the hospital is very large when it comes to this topic. However, typically if you're a nurse in the hospital, you're going to be dealing with patients that are unstable. So you really need to be on your P's and Q's when you're working in the hospital. When I transitioned from long-term care to the hospital, I would always think to myself that at the nursing home, if the patient, if there was something going on with the patient or something went wrong, we just send them to the hospital. But now you are the nurse at the hospital, so you just can't send them to the hospital now. So you've got to figure out what's going on with them, right? So at the hospital, you're going to be dealing with a very acute patient. You're going to be dealing with the unstable patient. So you're going to be responsible for making that patient well to therefore go home or go to another skilled or go to another facility. So absolutely, you're going to be dealing with a lot of different things in the hospital. You're going to be getting a lot of skills, dealing with a lot of things you've never seen before. You're going to get a lot of knowledge working in the hospital. It's going to be faster pace, of course. It's going to be a lot of different types of patients. Like I said before, all these different areas of nursing depending on where you work. So the hospital is really going to have you have a larger wealth of knowledge, and you're going to be dealing with the more unstable and the more acute patient working at the hospital. Now, a skilled nursing facility. Now, let me just say this. A lot of people like to use long-term care, LTC, and skilled nursing facility, SNF, or some people call it SNF. Some people like to use these terms interchangeably. However, they are technically not the same thing. So the first thing, let's talk about SNF, skilled nursing facility. Now, these facilities typically take patients that are basically not sick enough to be in the hospital, but they are not well enough to go home yet. So as a nurse in a SNF facility, you're going to be taking care of a lot of patients that need rehab, meaning that they have either had, maybe they've had a stroke, they've had a hip replacement, they've had knee replacements. So you're going to be dealing with a lot of rehab in a skilled nursing facility. You may also have a patient, a lot of things that we see at a skilled nursing facility is that sometimes a patient needs to continue a certain IV antibiotic regimen, but they don't necessarily trust that the patient would adhere to this antibiotic regimen at home. So a lot of times doctors will send them to a skilled nursing facility. Now these patients are going to be not as critical as the hospital, but also not as stable as a long-term care patient. You really have to be mindful about these patients because these patients can turn really quickly. And no shade to no hospital, but no shade to no doctors, but a lot of times patients will be discharged too soon from hospitals and get into long-term care facilities, not long-term care facilities, SNF facilities, and in some cases long-term care facilities, and then you got to send them back to the hospital because they still sick as shit. So you have to really be mindful about these patients because a lot of times they are not well enough to transition to a skilled nursing facility. So you really have to be mindful. Working in a skilled nursing facility, you can be dealing with IVs. You're going to be dealing with, you may have a lot of wound care as a nurse. You may, we've had a lot of patients here working at the long-term care or SNF facility. I work at patients with heart monitors, dealing with PICC lines. We actually had a patient with TPN come into this skilled nursing. So a lot of these skilled nursing facilities are getting really acute patients, in my opinion. So you really have to be up on your skills if you consider yourself working in a skilled nursing facility. That's what you're going to be dealing with. Now, LTC. Now, which LTC stands for long-term care facility. Now, with a long-term care facility, you are supposed to be dealing with a stable patient, right? These patients are basically patients that are otherwise health-wise stable, but they may have a lot of mobility issues. They may be incontinent to where they need a lot of personal care to where they can't stay at home, or they don't have adequate care at home. Now, I say one of my pet peeves is that people mix in long-term care facility patients and skilled nursing facility patients. These patients are two different types of patients. For example, skilled nursing facility patient, SNF patient, 56-year-old female, post bilateral knee replacement who needs a few weeks of therapy, versus 86-year-old female who is basically unable to walk but otherwise medically and health-wise stable, but is incontinent, unable to care for herself, unable to prepare her meals, unable to take herself to and from the bathroom. Now, here lately, they have been combining these two. Now, if you work in a skilled nursing facility, you should be having roughly between 10 to 15 patients. To me, that's a safe ratio dealing with skilled nursing facility patients. Now, in a long-term care facility, you may be having between 20 and 30 patients. Now, there's still a lot of people, but you're dealing with a less acute patient. You're dealing with a overall stable patient. These patients are typically only getting medications, PO meds. So, but the problem that I see here lately is that they're mixing and mingling long-term care patients and skilled nursing patients, which is not a good thing. For example, if you, let's say you walk into a quote-unquote long-term care facility, and some long-term care facilities have skilled nursing facility wings, which only have skilled patients, but here lately they've been trying to mix and mingle these patients. So for example, let's say you have 25 patients and 5 of those are skilled nursing facilities getting IVs, getting wound care, getting all these different types of this more acute, more acute care, and then you still have your 20 long-term care patients, so that can get kind of overwhelming. So that is, in a small explanation, the difference between the hospital, skilled nursing, and long-term care. Thank you guys. Leave a comment below if I missed anything about these different types of facilities. And have you guys been noticing a lot of nursing, really acute patients coming into long-term care facilities? And mind you, nurses are not always trained to handle these types of patients. If you work long-term care for all these years, and then you get a patient that has TPN, first of all, you're like, what the hell is TPN? What is that? Never done that. So you guys comment below if you guys have any input. Follow me on Instagram at Adam Deshawn, and I will see you guys in the next one. Happy nursing. Bye-bye.